precautions to take when prescribing opioids for refractory restless leg syndrome. Restless leg syndrome, or RLS, that is unresponsive to traditional therapies or in which the patient can't tolerate traditional therapies, can be frustrating for clinicians and patients alike. Opioids can be a viable therapy for these patients, and a paper published in the January 2018 issue of Mayo Clinic Proceedings aims to illuminate this treatment pathway. Michael Silber, MB, CHB of the Mayo Clinic College of Medicine and Science and an author of the new guidelines, told Sleep Review, "We've known for many years there is a percentage of patients with chronic restless legs who are refractory to other treatments like dopamine agonists and alpha-2 delta ligands, and a significant percentage of these patients benefit from opioids. The drugs have been studied for a while and in low doses are highly effective to manage restless legs." I'm Sri Roy, and you're listening to Sleep Review, the trade media outlet for the sleep medicine subspecialty. This podcast is inspired by the growing awareness of the importance of sleep to overall health. We invite all healthcare professionals, from primary care physicians to sleep specialists to dentists and others, to tune in and learn about clinically based best practices that will help your patients sleep better. Sleep Review does not endorse any products or services, including those that advertise with us. We strive to report clinical information that you can apply to your practice today. This episode is brought to you by the MedCore platform. Learn more at medcore.com/our platform and stay tuned for more information during the break. The Restless Leg Syndrome Foundation put a task force together, which Silber chaired, to look at the use of opioids in RLS and produce a paper for the benefit of primary care providers and specialists in the reasonable, appropriate use of the drugs. This episode shares the task force's 4 essential precautions when prescribing opioids for RLS, as related to Sleep Review by Silber. You can get the print article this podcast is based on at www.sleepreviewmag.com and search for the headline, 4 Precautions to Take When Prescribing Opioids for Refractory Restless Leg Syndrome. The direct URL is www.sleepreviewmag.com/precautions prescribing opioids refractory restless legs syndrome with a hyphen between each word. Precaution number 1, try non-opioid strategies first. Try other drugs first, like the dopamine agonists and alpha-2 delta ligands. Try strategies to improve response to other medications and consider alternative and combination therapies. Precaution number 2, consider other treatable explanations for RLS. Look for other factors that can worsen restless legs, for example, low iron, and address those first. Next, we'll share 2 more precautions to take when prescribing opioids for refractory RLS. But first, a thank you to our sponsor, the MedCore platform. MedCore's mantra is not only to innovate within our company, but to provide a data platform for sleep medicine stakeholders to drive innovation within their own businesses. Gain access to hundreds of core data sources, including medical journals, blogs, social media conversations, advertising, emails, and articles. Start leveraging device market insights across your enterprise to make informed decisions at every level today. Sign up for a free demo at medcore.com/our platform and fill out the form at the bottom to schedule a MedCore demo today. That's medcore.com/our-platform. Okay, now here's the next precaution. Precaution number 3, assess for risk of addiction and educate patients on responsible use. There are a number of validated questionnaires that can assess patients' risk for addiction. Use one to inform your decision of whether to prescribe opioids to a given patient. Then, educate patients on responsible use. Have each patient sign an opioid contract, where the conditions of the contract include an understanding of side effects, that medications will be obtained from a single provider and a single pharmacy. The provider will not issue repeat prescriptions. The patient will not increase the dose without consulting the provider. and the drugs will not be shared with anyone else. Precaution number 4, start with the lowest dose and monitor over time. Start with the lowest dose of opioids possible. Monitor patients over time for effective and safe use. Providers should do a urine drug screen at the start of treatment and at ongoing regular intervals. Also consult the state databases of drug prescriptions to be sure the patient is obtaining opioids from one provider only. The biggest takeaway is that the new Mayo Clinic Proceedings paper should instill a sense of confidence in physicians to start prescribing opioids to refractory RLS patients who can use them safely and responsibly. Use precautions, such as trying other treatments first, looking for other treatable conditions that may be worsening RLS, assessing for addiction risk and educating patients, and starting with the lowest dose and monitoring over time. That way, you can provide effective and responsible care for your RLS patients. You've been listening to Sleep Review. I'm Sri Roy, editor. Visit www.sleepreviewmag.com/precautions-opioids-restless-legs-syndrome to read a print version of this article and access any cited studies. Remember to visit sponsor www.medcore.com/our-platform for a free demo. Tune in again next week for more clinically based best practices that will help your patients sleep better.